Antibiotic resistance occurs when bacteria develop the ability to survive and grow in the presence of antibiotics, rendering these medications ineffective in treating bacterial infections. It poses a significant global threat to public health, as it limits treatment options, increases healthcare costs, and leads to higher rates of morbidity and mortality. Methicillin-resistant Staphylococcus aureus, MRSA. MRSA is a strain of Staphylococcus aureus bacteria that is resistant to multiple antibiotics, including methicillin and other beta-lactam antibiotics. It causes difficult-to-treat infections, such as skin and soft tissue infections, pneumonia, and bloodstream infections. MRSA is a major concern in healthcare settings, but community-acquired MRSA infections are also increasingly prevalent. Carbapenem-resistant Enterobacteriaceae, CRE. CRE refers to a group of gram-negative bacteria, including Escherichia coli and Klebsiella pneumoniae, that have developed resistance to carbapenem antibiotics, which are considered last-resort treatments for severe infections. CRE infections are associated with high mortality rates and are challenging to treat due to limited effective antibiotics. Extensively drug-resistant tuberculosis, XDR-TB. XDR-TB is a form of tuberculosis that is resistant to the most effective first-line and second-line anti-TB drugs. It requires specialized treatment regimens and has limited treatment options. XDR-TB poses a significant challenge to global tuberculosis control efforts and is associated with poor treatment outcomes and high mortality rates. Vancomycin-resistant Enterococcus, VRE. VRE is a type of Enterococcus bacteria that has become resistant to vancomycin, an important antibiotic used to treat serious infections. VRE infections are commonly associated with healthcare settings and can cause urinary tract infections, bloodstream infections, and surgical site infections. Multi-drug-resistant Acinetobacter baumannii. Acinetobacter baumannii is a gram-negative bacterium that can cause infections, particularly in healthcare settings. It has developed resistance to multiple classes of antibiotics, making treatment challenging. Infections caused by multi-drug-resistant A. baumannii are associated with high mortality rates, especially in critically ill patients. Multi-drug-resistant Pseudomonas aeruginosa. Pseudomonas aeruginosa is a gram-negative bacterium that commonly causes healthcare-associated infections. It has acquired resistance to multiple antibiotics, including beta-lactams and fluoroquinolones. Multi-drug-resistant P. aeruginosa infections are difficult to treat and often require combination therapy. Extended-spectrum beta-lactamase, ESBL, producing Enterobacteriaceae. ESBL-producing Enterobacteriaceae, such as Escherichia coli and Klebsiella pneumoniae, have developed resistance to a broad range of beta-lactam antibiotics, including third-generation cephalosporins. ESBL-producing bacteria are associated with various types of infections and pose a significant challenge in both healthcare and community settings. Clostridium difficile infections, CDI. Clostridium difficile is a bacterium that can cause severe gastrointestinal infections, especially in individuals who have been treated with antibiotics. Some strains of C. difficile have developed resistance to multiple antibiotics, leading to difficult-to-treat infections and recurrent episodes of CDI. Neisseria gonorrhoeae. Neisseria gonorrhoeae is the bacterium responsible for the sexually transmitted infection gonorrhea. The bacterium has become increasingly resistant to various antibiotics, including fluoroquinolones and extended-spectrum cephalosporins. Rising rates of antibiotic-resistant gonorrhea pose a major public health concern globally. Streptococcus pneumoniae. Streptococcus pneumoniae, a common cause of pneumonia, meningitis, and other infections, has shown increasing resistance to antibiotics, including penicillin and macrolides. Drug-resistant strains of S. pneumoniae complicate the treatment of pneumococcal infections, particularly in vulnerable populations. Addressing antibiotic resistance requires a comprehensive approach, including responsible antibiotic use, infection prevention and control measures, surveillance systems, and the development of new antibiotics and alternative treatment strategies. International collaboration, public awareness campaigns, and improved healthcare practices are essential in combating antibiotic resistance and preserving the effectiveness of antibiotics for future generations.